our situation report. And I'm going to hand the time over to Tyree. Tyree, I will let you share your screen.
Yes, hello, can everyone hear me?
Yes.
Well enough, okay. Let me share my screen.
Go ahead.
Okay. All right. So here's our situational report and updates that we give to most of our community, such as or let me say who I am first. Yate Bene, or not Bene, just Yate. My name is Tyree Honani. I'm the communication specialist. So I do a lot of the public messaging, and I work alongside Alfred Pete, the PIO. So we just go out to the communities and make sure everyone's informed and updated on everything. And I also work with the schools and all of that stuff. So yeah, today we have the situational report update. Like I said, we get these out to the chapters a lot every time they have a chapter meeting or just kind of in general. So we'll start off with our 14-day positivity rate. It is 20.14%, and out of that is 144 positives. So I marked it in green because it's been decreasing a lot. We over like the past few weeks, it's been almost up to 30%, which is we kind of had a little bit of a rise in COVID cases, but now it's finally decreasing, and hopefully it does stay that way. And then we have our graphs here. So we split them up into the years, so it kind of is a more visually, you can very much understand it. And we have 2020, 2021, and then 2022. And if you see on the right hand side of the where the dash box is, that's where we are. So you can see that we did have a bit of a surge there, and we're finally decreasing. And our testing drive-through is open always Monday through Friday. Well, not always. Holidays we're not open. 8:30 a.m. to 4 p.m. Closed from 12 to 12:45 for lunch. And then we have our vaccine clinics Monday through Friday, 8:30 a.m. to 4 p.m. And we are also closed 12 to 12:45 for lunch. And one update is Loop Clinic is reopened. It is reopened only for scheduled appointments, meaning we have no walk-ins, and it is only open for limited services. Pharmacy is also open over at the Loop Clinic. It is also open limited medication distribution, and there is the clinic and pharmacy hours. It's Monday, Wednesday, Thursday, and Friday from 9 a.m. to 4 p.m. and Tuesday 1 p.m. to 4 p.m. There are no dental services, and masks are still required inside that building. And here's another reminder that our pharmacy is closed on the first Tuesdays of each month from 8 a.m. to 1 p.m. and they reopen at 1 p.m. on the same day. And this one was included because we had a lot of, well, it should always be included since we're still in the pandemic, our mitigation practices. So we do the, always get vaccinated and get boosted. And we just encourage others to encourage to get vaccinated and practice hand hygiene and properly washing your hands and sanitizing hands regularly. Being mindful of social gatherings always and avoid large gatherings to keep the spread of COVID-19 low. Wearing a mask in public indoor spaces, staying home if symptomatic, a runny nose or a cough may not just be allergy, so we encourage to get tested if you become symptomatic. And here is some flyers that I made just to update on the vaccines. So since the 6 months and older vaccine has been released, so just reminding them that we do have those here, and the clinic hours are Monday through Friday, again, 8:30 a.m. to 4 p.m. And then the flyer on the right has the same thing of the 6 months and older, but it also does include that boosters are available for 5 and older. And then this is a vaccine schedule that me and one of the nurses made here. It is kind of almost the same as the CDC's, but we just kind of made it to where it's more easier to flow through, mainly the purple parts. So it's just Pfizer and Moderna and the J&J. Just, they have the different doses and then the time in between when you get to get your next dose or your booster. So that's that. And then we have the ages 6 months and 4 years. So this one's the newer one for the 6 months vaccine. And again, it's pretty much the same, almost the same, but it does have the 6 months and older, they have 3 doses. So that's pretty much the only change in that. And it is only available for the Pfizer. And this is a new thing that I included into our updates is the COVID-19 associated hospitalizations among children and adolescents from 6 months to 17 years. So as you can see in the red, where the arrow is, that's the population where it's most affected by COVID-19 and hospitalizations. So that's why we encourage, to get vaccinated. And then here we have our vaccine doses and vaccinations given by date here at WIC. So just to mark out the trends right here, you see in the first graph, we have the upward trend that coincides with our community vaccines and boosters and pediatric vaccines that have been released. So, doing those really does help our communities in coming in and getting vaccinated. And as well as the end, as you can see on the graph below, is to kind of see of a slight increase at the end, a little peak. That's where our 6 month plus vaccines have been increasing a bit. So I just added this because it's very, you can really see how our vaccinations trends are. So then here is our newer, I would say, our school banners. So we are hanging these around the res in our service area. They are our roadside banners, so you might see them when you're driving around. So we have the sore throat and, just really encouraging students to stay home, if they're feeling sick or anything. So you might see these out in the community. If you would like one at your school, you can just let us know, and we are trying to put them out, maybe putting our own stands out there, or even like posting them on the gates. And then another update for our Just Move It, it passed, but just thanking everyone who participated and encouraging everyone to keep walking and running every day. So yeah, thank you.
Awesome. Good job, Tyree. Thank you very much for all the information and updates. That is very vital to all of our schools to be aware of. Do we have any questions or any comments on these slides that Tyree showed?
I have a question.
Okay, go ahead. Hi, Regina.
Hi, Sasha. Hi, everyone. So just given the based on Tyree's report with the hospitalizations and infants and early childhood age group. So what is the uptake with vaccines in that age group? Is that something that you guys are finding parents are taking, or is it a little bit of I guess challenged? I'm just trying to get an idea in terms of the vaccinations with these little ones.
We do have our Dr. Dorval is on here. I don't know if she's able to help maybe answer the question a little bit about maybe her experience with what parents are saying for that age group, 6 months and older. Also, Tyree, would you have more detail on how our numbers have been for the vaccinations of that age group, 6 months to 5 years old. Do you know how the trend has been lately? Like, do we vaccinate, 5 a day or?
Yeah, so I don't currently have the trend for that age group. All I know is I don't think I'm sharing my screen anymore. Oh, the graph set for the COVID vaccine doses, those were the ones just kind of for our whole service unit for each age group. I might have to ask Peter on that to share with me if he has the different age groups in that.
Okay. Okay,
Okay.
so we can gather that information. I know we do have our clinic here in the main office building. It is a walk-in clinic, so parents are able to come and get their child vaccinated for the 6 months to 4-year-olds. We're giving Pfizer, and there aren't a whole lot of parents that are rushing to get their kids vaccinated.
Yeah.
I think there's still a lot of question
Hesitancy.
and
Yeah.
resistance. Yeah, hesitant. But for the most part, the ones I work vaccine clinic just one time, and I was able to vaccinate some younger ones, younger than 5, and no issues. We
Okay.
observed them for 15 minutes, and they've been fine. So
Okay.
it's just continuing to get the word
Yeah.
out and continuing to educate that it's going to help in the long run. We did have, I know over the summer months, we did have a young pediatric patient hospitalized. So I only know of one, and that child was not vaccinated yet, and but they were hospitalized for respiratory issues. But that was only one I knew of.
Okay.
I think Dr. Dorwell might be tied up with patients, but
Okay.
maybe if she wants
No,
to speak to it a little
yeah,
better.
that's fine. Thank you. Yeah, just so I will have a group of public health nursing students this semester. So we'll be starting in October. So I'm hoping to take a group out to Winslow area. So I'll be in touch with the team there, but just kind of keeping my eyes and ears open here to kind of see what could be some potential projects for nursing students. So as
Okay.
well.
Okay.
But thank you.
Okay.
Maybe I
Thank
could
you.
add on, Sasha.
Go ahead.
This is Al.
Go ahead, Al.
Yeah, it's very difficult to really get the word out to every household here on the res because there's hardly any newspaper circulating, even though they're being published. And news-wise, we don't even get on TV. It's what the people watch. Social media it usually just hits the young people.
Mhm.
So that's another thing. Maybe that could be an NAU project.
Okay.
How we could knock on everybody's door. just a comment. Thank you.
Okay. All right. Thank you.
Thank you, Al. All right, great. Well, I'm gonna continue on and share some more information, and feel free to raise your hand, unmute yourself if any questions arise. We really want to make sure that you are given the opportunity to ask questions. So let me share my screen here, and I'm just going to add on to the update that Tyree gave. I have here the school task force update as far as tracking the school age. So I just want to show you the graph. This is a whole year, a graph that represents the whole school year. And we did include the summer months only because there was summer school. And then we just had a month after that to where kids were not really in school, but they did participate in some activities. And so you'll see on this graph where May 29th is where I kind of did a different color on the number of cases, but this is cases by the week, school age. And these would be kids who we came up on our radar through that were tested here or that were also transferred here from outside facilities because they live within our service area. So we see that through the summer months, the numbers started to trend up. I don't have an updated graph because we just barely passed through 1 week, and that number for the first week of school was 19. So we'll see how we do this week. So it's still staying about, between that 17 to 22 range. It's been like that since the beginning of July. So just to show you how we're doing on positive COVID amongst the school age. And so we will start with a new graph for this next new school year and keep track of that as well. Okay, oops, I wasn't supposed to do that. Sorry about that. Trying to get back into the swing of things again. We're in the routine. Here's the Navajo Nation update. They did change up what is shown on their website a little bit, and they are keeping track of the variants of concern, and they have the numbers here. And it's like before it used to be kind of a simple like, oh, it's the Delta, oh, it's Omicron. Now it's like BA and then all these different numbers. And it's even getting different to BA 2.12.1. So just showing you that, showing how the last 30 days look like. They have this graph, it kind of went up and then it's going back down. And right now the Navajo Nation is considered in yellow. And for those of you who attend the Navajo Nation School Leadership meeting, they happen every other week, and there you get a full report of the epidemiology report. So I encourage you to attend those meetings, and those meetings are for you to ask them questions about how things are handled on Navajo Nation and anything to do with school policies and stuff. So if you don't attend those meetings, I encourage you to do so. Some of the key things they mention is that these meetings, those meetings from DODE, Department of Education, will continue to happen every other week for now. And they're changing out their school framework to instead be school guidelines for COVID-19 mitigation. So they're gonna finalize the document, and they should be emailing that to you. I should be getting a copy of that as well, and I will email it out as well just in case it misses anybody. There was some question about mandating COVID vaccinations in the schools, and the advice was to be cautious about that due to legalities. So for each school, it's individually going to be based on your school leadership decision, but the advice is to make sure you get legal advice from, if you have a lawyer that could help you out. But otherwise, nationally and Navajo Nation-wide, there's no law in place or that is mandating vaccines for kids to attend school. So just an update on that. They talked about for the past 2 weeks, there are 69 chapters that were in the high risk category for 2 weeks, 69 chapters. Out of those 69 chapters, 6 of them are part of our service area: Delcon, Indian Wells, Jedito, Loop, Tisto, Bird Springs. So just to let you know that. And then they list some communities that have been in the high risk group for more than 6 weeks. And 3 of those were in our service area: Indian Wells, Loop, and Tisto. So we do want to continue to be cautious and careful and mindful with the spread of COVID-19. And they did talk some about the strain that is getting to be more popular of Omicron. It's called the BA.2.12.1. So, and I'll talk about that a little later. And then they did go over some information about monkeypox, which we'll cover a little later. So that's the update for Navajo Nation. And then for county updates, they're really pointing us toward just going to the Arizona Department of Health Services if you're interested, if you want to track and see how things look. And this is the information that will be provided here. And so if you look at this first box, that's Navajo County, shows the positivity rate. It shows, you know, all the different information there. And then if you look at Coconino County, same thing. They show positivity rate, even in the vaccination rates and stuff, new number of cases and stuff like that. So you can refer to those websites for the update, but I just wanted to point you to that direction. Okay, let me move on to ask if anybody has questions before we move on to new business. I heard somebody unmute. Okay, all right, so you are free to ask questions. Don't hesitate. So I wanted to talk a little bit about the COVID variant. It's in a lot of discussion, and this information has been updated very recent within the past week or two regarding COVID variants. Everything here you're gonna find directly from the CDC website. And sometimes when you go to the CDC website, you don't really know where to look or where to find information, or it's just a lot of stuff. But just talking about variants, I know can kind of get confusing, maybe sound a little scary, or, you know, it concerns when people say there's a new variant, you know, and people don't really know what that means. And all it is just means when there's the virus itself is mutating and changing a bit, and there's something new emerging. And so it is expected with viruses. And you know, as I was thinking about this, you know, just kind of explaining the reason why we have, for instance, influenza, we have a new vaccine every year because it changes. You can't use the same vaccine you used last year because it's not going to cover the same strain of flu as occurring this year. So it's different every year. And that's just how that acts, the virus acts. So same thing that's taking place here. And one thing they're finding is that the variant that is sticking around is Omicron, and Omicron has subvariants. So we're still with the Omicron, and then there's subvariants. And so I'll kind of show you a picture of that a little later. And CDC, local and state public health officials are watching that. They still know that vaccines help reduce the severe illnesses and hospitalizations and deaths. And so continue to stay up to date with boosters. And then you would want to continue also to take those precautions. And there are some changes that they noticed, and I'll go over that. Again, Omicron is a very variant of concern, and they first found it in South Africa. What they do know about this one is that it spreads more easily than other variants. And so the symptoms are similar to what we've been learning all this time. But what they see is that data suggests Omicron is less severe in general. However, a surge of cases may lead to increases in hospitalization and death. So also the other thing is there's breakthrough infections. We see that. I still have questions on the whole 90-day time frame, but right now it's still suggested that if you had COVID in the past 90 days, you should have antibodies. However, there may be those rare cases where somebody gets reinfected in less than the 90 days. So breakthrough infections are happening. We do know that for sure. And then there's treatments coming out. So a lot of the people that are in the high risk category, maybe they're older than 50, maybe, or elderly. A lot of times, especially if they're having the symptoms, severe symptoms like, the chest congestion, the cough, really severe cough and all of that, a lot of times those patients are being treated with certain treatment regimens that's now available for COVID. So just an update on that. And like I said, the Omicron, more specifically, what CDC says is spreads more easily than earlier variants of the virus that cause COVID-19, including Delta. And CDC expects anyone with Omicron, regardless of vaccination status, whether or not they have symptoms, they can spread the virus to others. And data suggests that Omicron can reinfect individuals even if they have recently recovered from COVID-19. So because about maybe in the springtime, what we had read and learned was that if you were vaccinated fully and boosted, you were less likely to spread COVID-19. But right now they're finding that regardless of vaccination status, whether or not a person has symptoms, they can spread the virus to others. And so the suggestion here, the presence and severity of symptoms can be affected by COVID-19 vaccination status, the presence of health conditions, your age, and history of prior infection. You should get tested immediately if you have COVID-19 symptoms, even if you are fully up to date on your vaccines, or if you've recently recovered from COVID-19, you should get tested. So now there's a popularity of the home test, and but there's still testing at the local healthcare facilities too. So I believe again that many people might not think they need to get tested because they think they had COVID, in 90 days already. So they think that it's not, but it could be. And so, I wasn't supposed to put this, supposed to delete this one. I was going to show you this information that's available to us. So it kind of gives you a visual of all these, the variants and then the subvariants of Omicron. So you see them, they're all there, and it's showing that of the Omicron variant, the BA.5 is the one as of August 6th that's mostly spread amongst the United States, but we're starting to see the BA 2.12.1. It's just very minimal. Then there's the BA4 and then the BA 4.6. So you can find all this information if you're super curious and you want to know, but all in all, it's still the Omicron variant. In Arizona now they have this. This is new information here that they have and shows you the different variants and the subvariants. So it's all here, and for Arizona, it is mostly the BA.5. And then they have this, I like this chart here. It shows the hospitalization. So if you look at the hospitalization differences, you see that with the Omicron, there has been less hospitalizations compared to the other variants in Delta. And then with deaths, also there's been a major difference too with the Omicron variant as opposed to the Delta and others. So that's the good thing. That's the good thing about how things are going now, where we can be thankful that the death rates have really come down. So any questions? Anything to add? Okay. The next thing we have on our agenda that I want to provide to you and give time for is Luana is the school health coordinator, Luana Benslow, and I want her to provide some information to you as we move forward with the school year. Yes, we're still got to do the mitigation measures for COVID and keep everyone safe, and our goal is that they're healthy at school. But we also want to just bring up attention to some other things and maybe just start the conversation too. Maybe you have some questions as well. Luana, I'll go ahead and let you take this time now.
Okay, can you hear me? Okay. Hi, everybody. I'm going to go ahead and share my screen, Sasha. Dude, I'm going to show everybody a short presentation. For those of you that don't know me, hi everybody. My name is Luana Benslow. I'm the school health coordinator here at Winslow Indian Healthcare Center. And I grew up in Delcon, but I am from Hard Rock, Arizona. So what I want to do is just go through a short presentation that I put together in regards to the school assessment that we sent out to all the schools and provide the feedback we received. Okay. So just wanted to share information about the Winslow Indian Healthcare Center. Our vision is to create a healing and harmonious environment in partnership with our communities. And our mission is to provide accessible, quality, and cost-effective healthcare. And our values are trustworthiness, justice, respect, dignity, service, and humility. I just want to share that with everybody. That way you know where we are coming from as far as an organization. WIHCC strives to make positive differences in the lives of our patients by providing care with respect and understanding of our culture, values, and beliefs of our patients. WIHCC chooses to reflect the values of the Diné people, which make up the majority of our patient population, in the values of the organization. WIHCC wants to be known as family and create a home for all patients where they feel safe to grow and become healthy. And also, we serve an estimate of 190,000 Native Americans. I work under the Youth Wellness Program, and which is under the Community Health Division as well. We have a Youth Wellness Nurse, which is Sasha, School Health Coordinator, which is myself, and then we have an office assistant here in our program as well. Our mission is to promote physical, spiritual, emotional, and mental health or mental wellness to sustain, rebuild, and strengthen our youth. In the communities we serve, the schools and community we serve are listed here. So there's Winslow, Joseph City, Holbrook, Jeddito, White Cone, Indian Wells, Delcon, Tisto, Bird Springs, Talani Lake, and Loop. And within these communities, we service, there's actually 24 schools. What Winslow School District has 5 schools. They have a estimate of 12,000 or 1,200 Native American students. Joseph City Unified School District has 3 schools, which is the elementary, junior high, and high school. And they have about 85 Native American students. All the way, there's Holbrook that has 5. We service Red Sands Christian School, Holbrook Indian School, Native American Christian Academy, Cedar Unified School District, which is the Jedito Elementary School, Delcon Community School, Sabadalkai Boarding School, Little Singer Community School, Loop Schools Incorporated, Loop Public School, Star School, and all the early childhood schools, which includes Navajo Nation Head Start, and also the Border Town Head Starts, FACE programs. We started working with them as well. And the numbers that are after the schools, those are about the estimate numbers of Native American students at each of the schools. From the assessment, like I said earlier, we as a school health task force team, which involves a lot of employees from our organization that have direct service to our schools. We came up with an assessment with 24 questions. I sent that to all the schools. 18 of the schools did respond, so these are the response that we received. One of the questions was, these are the questions that were there, really just to see which services they have and what services they don't have. So at the bottom, you'll see school health aide or nurse. The lighter blue is the yes, and the darker blue is no. So if we look at the yeses, so there's a school health aide. About 11 out of the 18 schools, they do have a school health aide. If they have a PE program, so it looks like a majority of our schools have a PE program, they have a counselor, they have school wellness policy, they have after-school programs, and they have a safety plan policy. The no's that are higher, which we, those are things that we're going to be looking at, is parent liaison. They don't have anybody that's affiliated or directly working with the parents. Other staff involved with school wellness besides the 4 that are listed. So, we're just going to see who else would like to be involved with the school wellness focus. Active school wellness advisory team. So making sure that the schools have an active team working on the wellness, on their wellness policy, making sure that that policy is being implemented and we can support them in that area. Another one I see is social emotional school curriculum. Most of the schools are solely directing their curriculum in that direction. So we just want to support the schools that aren't doing that so far, and what can we do to support them. The other one I see is resource or security officer. It's good to know that if they have some type of either a security officer or resource officer supporting their school, they're at their school for the safety of the students. It just gives us, these questions just give us an overlook of what services are being provided and what services aren't being provided. That way we'd be able to know where the schools need support. Here, off of the whole school, whole child, whole community model, which is the Wisc model, these are questions that we ask the schools to see if they provide any of these services at their school. So we see that community involvement is very high. Out of the 18 schools, there are 15 schools that have community involvement. And the top 4, actually looks like top 5 would be family engagement. They're doing very good in that area. Counseling, psychological and social services are good. Nutritional environment and services, and health education. So the 4 that I see that are lower end is physical environment, social, emotional climate, health services, and physical education and physical activity. So we want to be able to look at that, which schools are in need of support, and that gives us an eye of where we need to support the schools. So I wanted to go over an overview of the Wisc model. And this is what we look at as far as looking at the wellness policy as well, to see if they have each of these components. There's 10 components. And right here, I just put a short definition for each of the areas. So here for health education, we're talking about when the school provides, when provided by a qualified trained teacher, health education helps students acquire the knowledge, attitude, and skills they need for making healthy decisions. When we're talking about physical education and physical activity, this helps students develop their motor skills, their knowledge, and behaviors. So making sure that these areas are being provided at the school. Nutrition environment and services. School nutrition services provide students with opportunities to learn about and practice healthy eating. Is that being done? So health services, school health services provide first aid, emergency care. There's a policy as well, an assessment of planning for chronic conditions. In addition, services provide wellness promotion, referral to prevention services, and student and parent education. And how does that look? Are these in their policies? Do all staff have an understanding of what these policies are and what to do in case of emergency, or if first aid needs to be given? And if there's a referral process as well. Counseling and others, these prevention and intervention services support the mental, behavioral, social, emotional health of students. Is this being done? Also, is there a policy on it? How does that referral process look? Making sure that that's there. And if it's not, that's what we're here for. We're here to, see and support and give our input in those areas as well. And also, if the schools aren't knowledgeable in the resources in their community, we'd be able to help them, understand their resources as well. The other 5 components are social emotional climate. A positive and social and emotional school climate is conducive to effective teaching and learning, making sure that kids feel belonged, and the school climate can affect student engagement and school activities, making sure that students are being engaged, they're asking questions. Is that safe environment there for the students? Physical environment. A health and safe physical school environment promotes learning by ensuring the health and safety of students and staff. Employee wellness, that's very important. We know sometimes we forget about that, because sometimes when we're looking at ourselves, we're making sure that everybody's being taken care of, everything around us is okay, but then we sometimes forget about ourselves. So making sure that we're taking care of our staff, making sure that our staff understand when they need a break and what are they doing to take care of themselves to be able to take care of the students. They're not doing well, then you're going to see that reflection of how their classroom is. So making sure that they're okay in that area. So fostering the physical, mental health of school employees, protect school staff, and by doing so helps to support students' health and academic success. Family engagement. Families and school staff work together to support improved student learning, development, and health. This is where the parent involvement, parent liaison, areas where they're working together, trying to figure out how to support the students. Not only educational, but also health as well. Community involvement. We're one of the community groups or businesses, organizations. So us being accessible and being here to be able to support the schools. And that's what we're trying to do. And that's the whole reason behind the assessment, is getting those questions, seeing what the schools need, hearing from them. We want them to make them feel that they're being heard and that we're here to support them. And we're trying to figure it out as well, because every school is different. And that's what we saw come in. There's a lot of similarities, but there's also some differences. So the other assessment, another question that we asked was, what are the top health related issues other than COVID that your school, each of the schools experienced in the last 4 years? And I forgot to mention, out of the 24 schools, 18 of the schools filled out this assessment. So these are of the 18 schools, this is what we gathered. Some of the top 5 related issues were mental health, and that was actually number 1, which depression, anger, suicide ideation, self-harm, anxiety, trauma, these were all under mental health. The next one was the flu cold allergy that they dealt with, nutrition, student diet, physical health, diabetes, obesity, overweight, physical activity, fitness, substance abuse, which is including vaping, tobacco, marijuana, social health, bullying, peer relationships. Other things that were mentioned were oral health, vision, and then also attendance. You know, that could coincide with, you know, them feeling, it could be a social health issue as far as bullying situations. It could be, you know, having the flu, cold, anything like that could affect their attendance. Parent involvement, and then negative home environment. So the plan for my part, as far as seeing the assessment and working with the school health task force team, getting together, having these meetings, what can we do with this information that we gathered? What are we going to do about this? And we know it's a team effort. So on here, I put teamwork, working with other programs within our organization, because like it takes a team, and creating that team, we can do a lot, we can get a lot done. And it's not just involving like myself, it's going to involve other programs and other organizations to be able to, for us to work together. So programs within our organization as well as outside our organization. We have good relationships with Navajo County, with Arizona Health Zone, with Navajo Nation. So working together with them, reaching out to them, sharing this information with them as well. And we want to also involve parents, all the schools, and community members, the chapter houses, anyone that would like to be involved, even reaching out to Navajo PD as well. So there's a lot of, programs, organizations out there that would, we could reach out to, get this initiative moving forward and completed. Provide cultural, emphasize family engagement school events. So culture, really involving culture, because there's a lot of teachings in our culture. Of course, that family engagement, to be able to have activities that engage everybody in the family, not just like the parents, not just the kid, the child, but including everybody there. And what does that look like, and what can we do? Provide enrichment activities during school breaks. There's kids that don't go anywhere during fall breaks, winter break, spring break, even summer breaks. That what can we do to still provide this education for them, making it fun, even looking at family engagement as well, during those times. Support youth involved community events. There may be events going on out in our communities, and it's youth targeted. So we want to be able to support them as well, finding that out, what's going on, and we want to say, hey, we are here. We're here to support whatever efforts you have as well. So that's what we're here for. And then, like I said earlier about the school health task force, we have a group here at our organization, and that's our focus is we're the ones that got this school assessment questions together. We work together to figure out what is it that the schools need. And then what is our plan? And this, figuring out this plan to be able to support our schools. And then of course, enhancing communication. How is it? There's so many different ways of communicating with our schools, with our students, to our parents. So what does that look like? One of the things that we're doing is we want to update our website with the youth wellness program. So how is that going to look? So right now we're under construction, and we're going to move forward with changing that and having it more engaging. If you have questions, like frequently asked questions, making sure that those are on there. That way you can just go to the website. I have a question on that. Let me see if it's on their website before I call or email them. And it might be, and if not, then you can always reach out to us. And execute MOAs with the schools. Right now, all the schools, we did send an MOA to all the schools. We've received 19 back out of the 24 schools. So we're still waiting on some. We really want to have these MOAs signed. That way we can work with the students, with the students, with the schools. So if you're one of the schools that haven't returned the MOA, please do so right away, because we want to start out and we want to work with your school. And yeah, that's all the information that I want to share with everybody. Again, I'm with the Youth Wellness Program. My name is Luana Benslow. I'm the school health coordinator. This is my email address, and this is my phone number that you may reach me at. And I can take questions or comments if anybody would like.
Do we have any questions or comments from anyone?
Dr. Dorville, can you hear me?
Okay, go ahead, Dr. Dorval.
I was just going to say, great job, great presentation, Luana. And Sasha, I know you guys have been working really hard to develop the youth wellness program and just be a source of contact for the schools and the community. So I just wanted to say, excellent job.
Thank you, Dr. Dorville.
Thank you. Anyone else? Any questions? Okay, we're nearing the end of our meeting. Thanks for sticking with us. I just want to take time, not too much time, but I wanted to review monkeypox real quick, because I know that's been a common question recently, and I wanted to just review that with you. Shoot. I'll get to start. Y'all see the PowerPoint okay? You see it? Good. Okay, so real quickly, monkeypox. So this was mentioned in the Navajo Nation School Leadership Meeting. And just to let you know that Navajo Nation Health Command Operations Center is making monkeypox a priority to monitor and just watch out, keep track of the situation. Then also, a fact sheet will be issued soon by Navajo Nation HCOC, but they said the same information that's provided on the state and CDC website is going to be the same thing that they provide. We did have a question about, is hand sanitizer and hand soap good enough to, to kill the virus? And yes, it is, hand sanitizer and hand soap. So it brings back just our general encouragement our whole lives is wash your hands good. Soap and water, how many seconds? 20 seconds. Or hand sanitizer. So I wanted to show you what's come available. Most recent information is some pictures, what it looks like. It's like kind of like blister-like, pimple-like looking. So these are some pictures that are available on the website if you're curious. And more information has come out. This is very recent, as of a couple of days ago. There's now a handout you can print from the CDC website. And this one is specific to teens and young adults. I have a feeling that this is going to be the age group that it's likely to spread, if anything, depending on the behavior. There's a lot of emphasis on that. So I'm going to go over this piece by piece. So what is monkeypox? It's a rare disease, and here are the symptoms: fever, chills, sore muscles, headache, or tiredness, and then a rash. So similar to COVID, right? COVID symptoms. And it says here, sometimes you may get a rash first, followed by the other symptoms. You might only get a rash without having other symptoms, and the rash may look like pimples or blisters. The rash is usually on the face, inside the mouth, other parts of the body, like your hands, chest, and genitals. Even though you should get better in 2 to 4 weeks, you should see a healthcare provider as soon as you get symptoms that can be from monkeypox. Emphasis on those with weakened immune systems from HIV, cancer, organ transplants, or other reasons, or a person's pregnant or have other skin problems like eczema, you may become more severely ill from monkeypox. How do you get monkeypox? Monkeypox does not easily spread between people. You can get monkeypox from close skin-to-skin contact with a person who has a rash or scabs from monkeypox. For example, this can include during hugging, cuddling, a massage, or close contact sports. It also includes contact with spit droplets during close conversation and kissing. It can also spread through sexual contact, including touching the genitals and oral, anal, or vaginal sex. You can also get monkeypox from contact with objects, fabrics, clothing, bedding, or towels and surfaces that have been used by someone with monkeypox. What can I do to protect myself? The best way to protect yourself from monkeypox is to avoid skin-to-skin contact with anyone who has a rash that looks like monkeypox. If you know that a friend or family member has been diagnosed with monkeypox, try to avoid contact with them if possible. If you must be within 6 feet of them, you should wear a respirator or well-fitted mask, and they must wear a well-fitting mask. Do not share silverware or cups. Do not touch sheets, blankets, towels, or clothing. If you do touch any of these things, you should wash your hands with soap and water or use an alcohol-based hand sanitizer. And if you are sexually active, talk to your partner about any recent illnesses. Be aware of any new or unexplained rashes on your body or your partner's body, including the genitals and butt. If you or your partner have recently been sick, currently have symptoms of monkeypox, or have a new or unexplained rash, do not kiss, cuddle, hug, touch each other's genitals, have oral, vaginal, or anal sex. So what should I do if I think I have monkeypox? If you have a new or unexplained rash or other symptoms of monkeypox, see a healthcare provider or your school health clinic. You can also visit a public health clinic. A public health clinic can be an option if you don't have a regular doctor or insurance. Let your doctor or nurse know you're worried about monkeypox. If you think you have monkeypox, cover all parts of the rash with clothing, gloves, or bandages, and wear a mask. Remember, there's several things to remember. Avoid touching anyone until you have been to the doctor. If your test result is positive, follow your healthcare provider's recommendations. Wash your hands often. Try not to touch your eyes. If you wear contact lenses, wear glasses instead if possible to avoid infecting your eyes. Stay in a space away from others until your rash has healed, all scabs have fallen off, and a fresh layer of intact skin has formed. This may mean wearing a mask around others in the place you live and cleaning and disinfecting frequently. You should try to avoid contact with pets and with people who are more likely to get very sick, like children under 8 years old, people who are pregnant, and people who have weakened immune systems or certain skin conditions. Okay, that is a review of monkeypox. So this handout in detail is available on the CDC website. Are there any questions? Comments?
There is a vaccine coming out. As I was driving here at lunchtime, there's an issue about supply. And so they're changing how they are going to administer the vaccine. It doesn't look like it's going to be an IM vaccine unless if it's for children. It looks like they're changing how they are going to do that so they can have more of a supply. But definitely need to be seen because there's other conditions that are very similar, including hand, foot, and mouth. The rash is probably, the pustules are probably a little bit smaller, but it might be hard to discern if it starts in the mouth. And then chicken pox, when it starts off, it could look like very similar to monkeypox as well.
Great information. Thank you, Dr. Dorval, for sharing that. We do have our Director of Public Health Nursing on our call right now as well, Denise Blackrock. Do you have anything to add, Denise?
Not really, but I guess the same thing that Dr. Dorval had discussed, vaccines. I know there has been questions in the community if the vaccine is available and when the facilities will start giving the monkeypox vaccines. So basically, the monkeypox vaccine is only given to people who have been in direct contact with someone who has monkeypox. And right now, the CDC and Departments of Health are monitoring all of those cases. So they determine who is getting the vaccine right now. So it's not like the COVID vaccine where it's available to everybody. So I just wanted to discuss that about the vaccines because there has been questions about that.
Okay, we do have a question in the comment. How prevalent is monkeypox in our area? How many cases?
According to Navajo County, there are no cases in Navajo County yet. The cases have been primarily in Maricopa County and I think a couple in Pima County so far.
Yes, and I can confirm that with a meeting at the hospital I was in yesterday, that they have seen no cases at Little Colorado Medical Center or their clinic.
Okay, good, thank you. And again, there has to be, that really close contact and kind of like rubbing up on people pretty much. So, different information I've read is, situations where people are in really crowded conditions like concerts or, bars or, those kinds of parties where, shirts are off and people are rubbing up against each other. That kind of a thing is some of the places where they've had outbreaks.
So are there plans to perhaps launch, I guess, an education campaign in schools, particularly, you mentioned teenagers, adolescent, I guess, just kind of wondering about that too. So any thoughts?
We haven't talked about any campaign in the schools, but that's a good idea.
Yeah.
So that like this handout here would be a great handout to make sure we distribute to our schools with the teenage population. And then even the local colleges. College
Definitely.
age. Is NAU doing anything?
We only have at this point just information, social media, but yeah, I think it's definitely, I think, growing concerns, I think at this point, with more and more media attention. So I imagine there'll be more efforts, but just
Yeah.
wondering, but yeah, scary.
Yeah. Yeah.
Yeah, just seeing some of the images and just yeah.
Yeah. Okay, but yeah, I wanted to just bring this up. And again, this meeting is recorded. So if you want to make sure that your staff at your schools or your facilities see the information as well, share the link with them so that they can review it and look it over. But it's all available on CDC website as well. There's even some videos, short videos and stuff like that. So we do need to continue to get the information. So, for one, it's not easily spread between people, but it can spread, and we just want to bring awareness about it and the ways it is spread. So, okay, if there's no other questions about monkeypox, I'll just go over a quick announcement. September is Childhood Obesity Awareness Month. We will have another meeting before the end of August, but just wanted to let you know the Youth Wellness Program will be in touch to plan an event in the different communities, and we do want to partner with the schools, so we'll be in touch soon. And then services can be provided to students after an MOA is executed with the school. And then Youth Wellness Program is available to participate in providing education in the community. So just keep us in mind. Contact Luana if you're having any type of event. And it helps us if you give us about like 2 weeks to a month notice in advance, because a lot of times our calendars already begin to fill up with other things, and we want to make sure that we can adjust our time or schedules and accommodate your requests. So we appreciate that. With that said, thank you everybody for joining our meeting. We did go over a little bit, but we're thankful for all the information provided today. So any last comments or questions?
Sasha,
Yes.
this is Julia.
Hi, Julia.
Hi. I'd like to know if you are giving out some more masks.
If you are in need of mask, send us an email. Send me an email, and then we will do a request to our incident command team.
Okay, I have another question too.
Okay.
Do you have any of those first aid, MediFirst box, those first aid boxes?
No, we don't.
No? No, you don't. Okay. I'll
No,
probably
no first aid boxes.
No. Okay, I'll probably just order some of them then.
Okay. All right.
All
Thank
right.
you, Julia.
Uh-huh.
Julia's from Jedito. I see her on. I see Tisiakin. Thank you, Renee, for coming, and Monica from Winslow Head Start, and Mary from LSI, Rosita from Little Singer. I see Samantha from Delcon School, Sylvia from Winslow Residential Hall. Thank you. Gloria Long from LSI. Thank you all for joining. And Janet, thank you for joining from Loop Public School. We look forward to our next meeting. So, but email us or call us if you have any questions. And thank you for all the partners who are on this meeting. Rhonda Little, thank you. And always reach out to her. She's from Arizona Health Zone. But as we start planning some events, we are going to include Arizona Health Zone and now working with us in these wellness events. So just to let you know that. And also our Health Navajo Nation Health Ed, Jerry Chi, thank you for joining as well. So everybody have a good afternoon. Thank you.